Hello. Thank you for being here with us to another episode of Learn from the Greeks. And our today's guest is Georgios Voidonikolas. Welcome. Thank you for being here with us.
Thank you, Christina. It's a pleasure to be here.
And could you please tell us a little bit more about yourself, your course of life?
So I was born in Greece. I grew up in Athens. I graduated from Pierce College, the American College of Greece. I completed my medical training at the University of Athens. After doing my rural obligation at the beautiful city of Sparta as a general doctor and doing my military obligation at the remote island of Castellorzo, I moved to the United States. I was involved at doing research on pancreatic cancer DNA at the genomic department of Baylor College of Medicine at Houston. Then I did my training in general surgery at the University of Texas, and subsequently did a 2-year fellowship at Transplant and Hepatobiliary surgery at Cedars Sinai here in Los Angeles. I'm currently an attending at Cedars Sinai. I am specialized at transplantation of liver, kidney, and pancreas, as well as surgical diseases of the liver, the pancreas, and the gallbladder.
And what intrigued you to choose the career path of surgeries, and in particular transplant surgeries?
With my father being a physician, I always considered the medical profession to be one of the most noble ones. As a medical student, I was fascinated to find out how surgery can very drastically reverse the course of the disease and change its physiology by intervening or interfering with its anatomy with your own hands. And later on, it was a very humbling experience for me to see how a transplant organ can change the life of a patient. You could see patients with liver failure literally dying in the ICU, and after they receive the organ, they come to the clinic 2 or 3 weeks later with their families to thank you. Also very gratifying to see how a kidney transplant patient is very thankful after he receives a new kidney and is not required to be on dialysis anymore.
What is your opinion for the Greek medical universities?
The Greek university provides a very strong and solid foundation of knowledge. In medical school and in other schools, they teach a very wide spectrum of subjects. And specifically, our medical students also have the unique opportunity to get hands-on experience by providing care to patients in our county hospitals for free without the need to pay for a liability insurance. Overall, the doctors from Greece are considered very well educated, and they have a very good reputation. They have been trained with very well acknowledged Greek professors and are welcomed to the hospitals both in the United States and in Europe.
And how has COVID affected you? And what is your experience from working in Cedars Sinai during this COVID crisis?
Well, the epidemic has affected all of us, both in a personal and in a professional level. At Cedars Sinai, over the past year, we have cared for almost 4,000 patients with COVID-19. To understand, this is a big number of critically ill patients that required a lot of adaptation from the system, the healthcare, and the doctors themselves. New research studies have been launched, and many clinical and operational innovations had to be done to be able to meet the needs of the community. In the Department of Surgery, we did have occasions where we had to cancel a transplant because either there were no ICU beds at some point, or the recipient or the donor tested positive for the virus. But with the vaccination now and the decrease in the surge and all the appropriate adaptations that hospital has made, we're doing our best to get back to the previous rate of transplanting our patients and not depriving any organ from somebody who needs it.
Could you offer some tips to someone who wants to follow the same career as yours, and where should they focus on?
So for a medical student who wishes to come and train in the United States, I would recommend that they work on getting good scores in the medical licensing exams. It did help me a lot to get a lot of interviews, having scored 99% on those exams. I would also suggest that they have a rotation as students in a medical school before they get their medical degree from Greece. And also if they have the chance to get involved with some research. Most of all, though, to a young student, I would encourage to follow their passion with persistence and resilience, even though sometimes things may look that they're not optimal for them. I think they should look for mentors and people that have succeeded before them. They should mingle with peers that have the same goals as them. And they need to know that medicine is a lifelong experience. It offers a lifelong training, but also requires dedication. It requires that you're devoted to your patients, that you show compassion to them, even when you feel you're drained or overworked. To be a good surgeon, I think you don't only need very solid training and knowledge and technical skills, but also a mindset of showing attention to detail and continuously pursuing excellence.
What did your failures teach you?
So as everyone else, I do have my failures, and what I learned from them is, first of all, to remain optimistic and keep on trying. I think every challenge should be addressed as a privilege, because you worked your whole life to be at the point where you're facing that challenge. And every failure should be embraced and should be considered a gift, because it will help you focus on that area of yourself that you need to improve. So I believe if we have a genuine and pure desire to succeed, and it comes from a good place, success will eventually come sooner or later.
Please tell us a word that for you better describes Greece. And what do you miss most from Greece? How many years you said you're here?
I've been to the States for a total of 12 years.
Hello.
And of course, when I think of Greece, I think of my family and my friends. And I do miss the blue sky. I do miss the water. I do miss the Greek summer. When I hear the word Greece, also the crisis comes into my mind, which I think should be more felt like an opportunity for the young Greeks to create again, reform and rejuvenate the country. Already, with our known Greek resilience and creativity, we have overcome a lot of these challenges. And we're heading to the point where soon we will be talking about brain gain and not brain drain anymore.
Do you have a place in Greece that you feel a special connection to?
Well, I grew up in Paliofaliro, and driving from Paliofaliro all the way along the Poseidon Avenue to the ancient temple of Poseidon, especially during the sunset, is a very majestic scenery and an experience that every Greek and non-Greek should have at least once.
Do you have a prominent Greek that you look up to And how has this figure inspired you?
In Greece, we are blessed to have a lot of personalities that can serve as role models for us. Historically, Greeks have excelled in medicine, from the founder Hippocrates to Galinos, later to Papanikolaou, but also contemporary Greek physicians and scientists have served as role models for me and inspired me. We have also a lot of prominent poets and novelists. I have chosen Kavafis, Elitis, and Nikos Kazantzakis. I believe if you study those three, you will find it very easy to get inspiration to live a worthy life. And finally, I would like to say that I am getting inspired by the anonymous Greek physician who is giving its best self and under any circumstances provides good care to our papudes and yayades in general, and also under the difficulty of the current COVID crisis.
That is a very good point, actually. All of us, thank you very much, all the doctors that really are paying attention to our health nowadays. You are our heroes. Thank you very much for being here with us today, George. And to our audience, stay tuned for our next episode of Learn from the Greeks.
Thank you very much. It was an honor and a privilege.